Good afternoon, everybody. Welcome to our third Community Leaders Update on the COVID-19 virus pandemic. I'm Mike Wilder. I'm the Director of Emergency Management for Boyle County. Also present, we have Judge Howard Hunt, Mayor Mike Perros, and Brent Blevins, who is our Director of our Public Health Office. Please use this number, 859-936-6568, to call with your questions or comments to either Judge Hunt, Mayor Perros, or to Brent Blevins. Each day, I receive from the Department of Kentucky Office of Emergency Management a situation report that kind of explains where we are in the state, what KYM is doing, and how they're responding to different things. Today I thought I'd give you a couple of points that are pretty pertinent to folks around here that might want to know some things. The big thing is the community-based drive-through testing sites are up and running to a certain degree in several of our cities already. I do know that Boyle County is probably going to be targeted for a testing site for a regional area. Where that'll be or any particulars, I don't know at this point in time. We will get further instructions as it gets closer to the time, and we suspect it probably within the next couple of weeks. Of course, Governor Beshear has requested that all the schools now have no in-person instructions through May 1st. I think everybody's aware of that, but it's kind of good to touch on that. A pretty good point. Also, state, county, and city governments now, and I know the mayor and the judge are both aware of this, but again, the public may have missed this. You can now rehire all retirees, not just first responders, without penalty to their retirement, which is a pretty good point. We may need them at some point in time. All the state park lodges, cottages, restaurants, and campgrounds are going to be closed effective April the 3rd. Some boat ramps operated by the U.S. Corps of Engineers may be closed as well. So all you fishermen need to check the state website for those closings to make sure you don't get there and it be closed. Talking about the community testing sites, we have 32 testing labs now that have been identified in the state of Kentucky. 32 of them are on board. So you can imagine all the testing that is being done, and I know Brent will he'll touch on the possibility of the fact that there are always discrepancy in those reporting figures that you get, and I know he gets a lot of questions about that. So without further ado, Judge Hunt, a couple of comments, please.
Yes, thank you, Director Wilder. I've got a memo here in front of me from Todd Block, who's Commissioner of the Kentucky Department of Aviation in Frankfort. And here's his opening paragraph. It's good information for those out there who like to fly and fly around the state. Now, I know I'm there, you do, and this is good information update. Here's another update from the FAA, this time with news about airmen's medical certificates. The FAA will not take any action against pilots flying on expired medical certificates if they expired between March 31st of this year to June 30th of this year. So if you're a flyer and your medical ticket has expired anytime after March 31st up to June 30th, please contact the FAA and for additional information. You can also find links to that on Governor Beshear's website, which is covid19.ky.gov, or the Transportation's website, which is transportation.ky.gov, /pages/home.aspx. I was visiting with one of our magistrates earlier today, and I want to read a letter, if I may, that he wanted read over this medium to the citizens of Boyle County. We have been ambushed by an invisible enemy from a foreign land. This is truly a time of war, the type of which we have not seen before. This is a call to action. We must retaliate by falling back on our training. We have been trained to follow the guidelines of social distancing, staying at home, avoiding crowds, washing their hands and surfaces, and many other common sense guidelines. They have been well publicized by our leaders. It becomes our responsibility to follow these orders and come together for each other as a district, a city, county, state, and nation. We are all in the same foxhole and must depend on each other. In order to help remember these guidelines, I ask each of you to place the symbol of this great nation close to the street for all to see as they travel. That symbol is our American flag. I ask our flag to be displayed anywhere that is appropriate. Examples on Main Street, homes, businesses. Throughout our history, the American flag has been a symbol to come together for each other and to never give up in trying times. Together, we can overcome this moment and carry our great nation to victory. It is signed to Victory Together, John B. Kaywood, Magistrate 6th District. Those are excellent, articulate words of wisdom and experience. And many of you can remember right after 9/11, all the American flags that came out and how it brought our country together. This is a similar type of event. And we need to come together as a nation, as we are coming together. And we ask for those out there to have patience as we work through these issues daily with a changing, a very rapid and fluid warlike fog of war situation. I appreciate Magistrate Kaywood's comments. Thank you.
Good afternoon, everyone. We live, and I say this, it's often overused, but we do live in a special county, special city. And I say that because you have listened and you've followed the directions, and it's working. And knock on wood, the cases that I'm aware of at our local hospital is 10, and I say that cautiously because every time you say something like that, it jumps. But you've done a great job. You ought to be proud of yourself. I am. This social distancing thing is tough. And guess what? It's going to get tougher. It's going to get tougher because it's pretty outside. We all want to go out and do things, and we can as long as we keep our distance. I know it's difficult when you go to Kroger and you have to stand outside to get in, but that's part of the process. And I ask you to consider this a bit of a marathon. It's not going to be over anytime soon. I was talking to a fella before I came in here. He's in Ogden, Utah, and he's a pretty smart fella. He thinks this will be June before it's over with. Who knows? Time will tell. But you've done a great job. Now, having said that, this still is serious business. I just saw just now that the UK Prime Minister Boris Johnson is now listed in intensive care. Now, this is a guy that contracted it a week ago. No big deal, quarantined himself. Now he's going to intensive care. Not the right path you want to be on, for sure. So it is serious. It doesn't discriminate. You're doing a great job. I think that's all for now.
Brent, you want to enlighten us with some updates and
Sure.
facts?
Sure. All right. Let's just go through some questions that I get on a daily basis and try to give you a little idea of how some of this works. I had a real good question from somebody or last week that said, what are some of the symptoms that we see out of the cases or people around here when they're actually a positive case? Thought that was a good question. So we kind of looked at our cases, and here it is. headache, chest pressure, fever, chills, cough, and maybe even gastrointestinal type issues. But those are just some of the main ones that we see out of a lot of the cases that we've already talked about here in this county. But it just gives you an idea of what that looks like. A couple other things. Well, let's just talk about the cases first. We do have 10 confirmed as of right now. But as the mayor said, that can change at any time, and it does. A lot of that is based on testing. We're fortunate. We now have several places doing testing here in this county. Our hospital's been doing it for a while, but we have several private providers doing that now too. So along with that comes that we will see more cases as being identified as positive because we're doing more tests in the community. And that's what we want to know. It helps us to isolate, quarantine hotspots or different groups of people that if we see a lot of cases coming up positive in one area, then we can work on that area to prevent that spread. Okay, had a really good question too. The CDC put out some guidance recently on wearing masks voluntarily in public. And what did I think about that? So here's what I think. Definitely, if you've got the mask and can do that and not taking masks away from our healthcare providers that need it. Let's make sure we understand that. But if you've got another version of a mask or bandana around your face or something when you go in a public place, great. But here's what you can't forget. You cannot forget social distancing just because you have on a mask. You can't forget washing your hands when you come and go from a place just because you have on a mask. You have to keep all those things together in mind because that's what makes a difference. But by all means, you can wear a mask to hopefully keep the spread down a little bit, and that certainly is one more tool that we have that can help. Okay, let's talk about groups for a minute. And we talked about this a lot, about not meeting in groups and not being together, and when we're outside, certainly enjoying outside, but not being together. Make sure that you are not being part of a group right now that is continuing to meet. I've dealt with 2 different churches today that are continuing to meet, and that is not what we want. Most of the churches I've been around are doing a tremendous job, either doing online services, having cars pull up in the parking lot, doing an outside service where people stay in their car, a lot of different variations of that. Use those methods to continue to meet, but don't be meeting together in one building together. The reason that we're looking at that, and I'll give you a great example of that. Here's what we're also discovering about the cases that we have right now. It's not just one person that's been diagnosed and then that's it. What happens is that branches out. So now we go from maybe 1 or 2 people up to 6 or 7 people associated with that case, and you can see how the spread starts happening. We have 10 cases and they've been around people, and then all of a sudden that multiplies to 20, 30, or 40 cases, and it all kind of traces back to maybe one meeting. That's a lot of numbers. And if every case we have that's positive ends up like that, you can see how quickly that can be almost an unmanageable number. So don't be meeting in groups, please. We've talked about that a lot, but definitely just don't be doing that. Testing. When Mike Wilder alluded to testing, that we would probably be down the road having a mass testing here in this county, that's great news. Here's kind of the discrepancy sometimes in the numbers that are reported that I'm reporting out every day at 4 o'clock on our Facebook post of the cases we have as compared to what you might see the governor reporting out. It's not a fault of the governor or anything like that. As we've had those 30 so many or however many private labs that have come online to do the testing, part of that is an educational piece. That those labs have to understand when they have a positive case, there are certain ways they have to report that in the state system so that we can see that data so we can immediately start working on the case contacts. It takes a while sometimes for a lab to understand how that works, or if they've had a large number of cases come in, it might take them a little while to get that data into the system. So therefore, I might see that data now. The governor on his end at the state level might not see that for a while, might be another day or 2, or maybe 3 days lagging behind. Eventually, as we go through this process, we will get that number where we're more in line on a daily basis. So I know your frustration on that, but every day at 4 o'clock, I post on the Boyle County Health Department Facebook page an update of what the cases look for, how many we've had new in the last 24 hours, and what our total is. And I think that gives good information for the citizens of Boyle County and Danville to see that and to know on a real-time basis what that looks like. Here's kind of the bottom line, and you see this in my post quite a bit every day at 4. As individuals, it's up to all of us to do the social distancing the best way that we can. Here's a great example of that. Our stores have been working hard to limit the amount of people coming in. Our city did an ordinance to back that up. Our governor has talked about that recently, to keep people from way too many people going in stores. But it's up to us individually as citizens to realize that we have got to go in one at a time, wait in line just like anybody else. And please, when you get in there, I've had reports called into me about this. Don't be rude to the people working at the stores you go in. Don't be mean to them. Don't act like they're not there. Those people are working as hard as they can to help all of us as citizens to have the groceries we need every day and to help us get the service that we need. Most people are really nice, but those of you who aren't, stop it. We don't need that. These people are doing a great service for us and we need to support them. Okay, I had another good question. How safe is it to handle mail? This is a good one. Keep in mind when you're looking at mail or any services or any surfaces, here's how that works. Remember, after you touch the surface, including mail, definitely wash your hands the same way, that 20-second routine. If you don't have soap and water, which is the best way, get some sanitizer. Sanitize your hands after doing that, and that way it minimizes the risk of anything living on that surface. And there could be a lot of different surfaces that we're talking about, doorknobs, mail, I've even heard gas pump handles, all those things. Take those same basic precautions no matter what you do. Okay, that's a lot of what I've got on my list. Anybody have any other questions that I've...
One question I've been asked, Brent, what about our protective equipment? How are we holding out? What's the latest on that? We haven't talked about that for a little bit.
Sure. We're fortunate here. We did get a push from the state a couple of weeks ago, and with that we got some masks, some gloves, some gowns, that kind of stuff. Plus Ephraim had already done a great job of trying to get their own supply. So we've been able to get them, maybe not exactly what they want every time, because those masks can be hard to find, but at least enough that they can do the job they need to do to keep all of us safe. Now, if we keep going like we are, and the usage where we can monitor that daily, where we can manage that, because our cases don't jump up to 100 or 200 in a day, then it's much easier for all of our healthcare providers to do that. That's why earlier when I talked about wearing a mask outside, make sure that's something besides an N95 or one of those masks that our healthcare people will need, because that's the kind of stuff they need so they can be healthy, so they can take care of us.
A couple of reminders too, while I'm looking through my notes here. Any agency that is involved in life-saving activities, grocery stores, nursing homes, hospitals, people like that want to file for some type of public assistance from the federal government, please do so. The deadline is April the 13th. I have the forms in my office, so anybody that feels they need to file for that, please contact me in my office. I can get you a form and you can fill it out and it'll tell you where to send it as well. SBA Emergency Economic Injury Disaster Declaration allows small businesses to apply for low interest loans. Be sure to be aware of that. All the businesses, and all you have to do is drive up Main Street at about 9 o'clock, 8:30, 9 o'clock, and it sure doesn't look like it normally does in the city of Danville. So be aware of that. One other thing while it's on my mind, I want to give a shout out to Mr. Bill Nichols here, guys.
I agree.
Who puts all this together for us, and I know how he stresses over it because my office is right next to his, and I have to listen to it. So he's doing a tremendous job, and we want to thank him for it. And each time he seems to find a way to make an improvement as well. I hear we've got a couple of questions here. I think, Brent, there are questions for you.
All
I
right,
think
let's see what we have.
you're the man on the spot.
Okay, let's do, the first question is, where are the sick people from? Restaurants, stores, wherever that is. Here's how we work those cases. Once we get a positive case, we do that contact list pretty quick, and then we run through it and call those people directly and say, hey, you might or you have been exposed to somebody who was diagnosed positive. That would include if we'd had a significant exposure in a building or something and we had to alert them, that they would then have to alert their people that had been in that building. That would include that. Kind of a case definition that we look at is within 6 feet in distance for 30 minutes or more. So when you keep that in mind, a lot of our contacts daily are we just happen to be passing somebody. It's not necessarily that we're sitting there talking to them for a significant period of time. So that's kind of how we look at that and as we try to work through those cases. But certainly if we ever have an instance where it is a major exposure to a business type like that, then we could certainly alert any public that had been in there based on the need that we have of that case. Okay, why don't we have a stay at home for 2 weeks in Boyle County? One of the things that our governor did early on, in whatever the terminology, stay at home or whatever that is, he started this weeks ago, and actually probably realistically more like a month ago, encouraging people, be at home, stay at home. His message has been consistent, as everybody up here's message has been consistent on this too. Stay at home. So to me, it's more just a terminology thing at this point. That's essentially what everybody's been asked to do already. Now that does not mean you can never leave your house. That means you go to the grocery, you get in, you get out. If you're still working, you go to work, you come home, get out in your yard, enjoy the sunshine, those type of things. But essentially, that's what we're doing now, is a stay at home for a period of time to let's see if we can continue to flatten this curve, which we are flattening the curve, which is a great thing for Kentucky and Boyle County. Yes.
I'd like to remind everybody, last Thursday, I spoke briefly about the Paycheck Protection Program. And Congressman Guthrie, our congressman here for this district, 2nd District, has called me twice personally and asked that I continue to promote that because that is an excellent resource for small businesses, including self-employed people and just virtually anybody that has a payroll, that they can file through the SBA for a loan. And if 75% of their requested funds go to payroll protection for themselves and their employees, at a time in the future that they can prove that, then that loan will be forgiven by the SBA. So that is a great resource, and he is so engaged with promoting it in all the counties out there. He's called me twice and said, please let all your small businesses know about the Paycheck Protection Program and to utilize that. I was watching, they started on April 3rd. We're on Saturday the 4th watching news. I think that day they did $17.5 billion worth of business for the federal government from across this country. So please take advantage of that if you can. There's a link to that on our website at boyleky.com and probably on every other website that the city has and that the state government and the federal government has through the Small Business Administration.
Mayor, you got
One last thing to begin a tradition tonight. It's not necessarily a tradition that is a good one, but every time we have a death in the state of Kentucky, at sundown we're going to illuminate City Hall in green, which is a symbol of across the state, across the nation. It looks like we're going to be meeting tonight, as there was a death over the weekend. Sundown, you're welcome to come and observe. My guest tonight will be the Reverend Amy Moe, priest from Trinity Episcopal Church, who's going to say a prayer. You can plug in on Facebook. You can come down and sit in your car. You can just stay at home, whatever works for you. But that's going to be one of our signs of recognition and an opportunity to remember why we're all staying inside.
It's lovely at night. We came up night before last and saw it. It's whoever did it put it together. It's very nice, very nice. Judge, you got
I
anything
know
else?
right now, Brent, you have any closing comments for us?
I like to do this at the end because we've got a lot of people in this community that have stepped up. And it's important to remember that we have gotten people who have called every single day for probably the last month to say, hey, if you need help, let me know. We'll do the best we can to help you. You know, I mentioned Wilderness Trail and United Way for helping do that sanitizer process. But I can tell you there are so many more. Already today, had at least 3 I can remember off the top of my head, different agencies and people who have called to say, we will help. And that is greatly appreciated. I will never remember everybody's name for that. But thank you for doing that.
All right. Without any other comments or concerns, we'll see you folks again on Thursday afternoon.
3:30.
3:30 in the afternoon. Judge, end it with your
All
comment.
right. Be aware and not scared. Thank you.
Thank you.
Be safe.